Hola, me llamo Carl Baloni Jr. y soy el vicepresidente y director de defensa de AIDS United. Bienvenido a AIDSWatch. Estamos muy contentos de que se haya unido a nosotros hoy. Hi, my name is Carl Baloni Jr., and I'm the Vice President and Chief Advocacy Officer here at AIDS United. Welcome to AIDSWatch. We are so glad to have you join us today. Escuche atentamente a la información sobre los servicios de traducción. Seleccione su idioma usando el botón de interpretación en forma de globo terráqueo. Si usted está usando su computadora, el botón de interpretación se encuentra ubicado en la parte inferior derecha de su pantalla. Si usted no desea escuchar la narración en inglés de fondo una vez que haya seleccionado su idioma, vaya a la opción Menú y seleccione Silenciar audio original. Si usted está usando un dispositivo móvil, Android o Apple, haga clic en los tres puntos ubicados en los controles de la reunión y seleccione Interpretación del idioma, luego seleccione Español. Si usted no desea escuchar la narración en inglés de fondo, seleccione Silenciar el audio. Gracias. Comenzaremos la presentación en breve. Thank you. We will begin the presentation shortly.
Hi all, welcome to day 2 of AIDSWatch. We're going to get started with our partners at the U.S. People Living with HIV Caucus. Ronald, over to you.
Thank you, Nora, and welcome everyone to the second day of AIDSWatch 2022. We're going to start the day with a community recognition of the leaders who have given so much in responding to HIV and other issues that confront all of us who are living with HIV and all of us who are affected by HIV. We are gathering here in our third AIDSWatch in a virtual environment because we're also in the third year. We're just starting the third year of the COVID epidemic. And as we remember and as we recognize our leaders, it's appropriate that we also pause to reflect upon those who we have lost over the past year. Yesterday, in her opening remarks on behalf of the caucus, Martha Cameron asked us to hold up all of those who we have lost. Today, I want to give particular notice and thinking about those who have passed away in the past year from HIV, COVID, and other illnesses and conditions. We also do this in the context that certainly the AIDS epidemic is continuing, COVID is continuing, and we witness daily the horrors of war around the world and in Ukraine in particular. So yes, we're going to celebrate our leaders and recognize our leaders, but let us also remember those who we have lost in this past year. Their battle is over, but the glory of their legacy remains in the hearts of all of us. To get us started, I'd like to introduce Cecilia Chung of the Transgender Law Center. Cecilia?
Thank you, Ronald. Hello, everyone. I was asked to say a few words about the award and what we're doing with it, and also present, the first award to a dear friend of mine. And it's not often that we get to connect with so many people, especially as people living with HIV. This battle has been going on for 40 years, and COVID reminded us, the isolations many of us faced. But this didn't deter Marco Castro Borges to really look at how to use his relationship, like to benefit not just the pure HIV community. He was a filmmaker. He was an ally to many different communities, and actually he's an accomplice to most of us here. And unfortunately, we lost him last year. Marco has been amazing leaders, not just in the Latinx communities, but also in the LGBTQ communities. And Marco's really able to see where some of the gaps are in terms of leadership roles, and make sure that he speak up and like call us in whenever possible. If it wasn't for Marcos, I think that like we probably wouldn't even be like opening the sessions with a Spanish speaking introduction first, because Marcos taught us that it's really important. Language justice is something that Marcos talks about all the time. So, and because of him, and his glory legacies, we have decided to rename our Positive Leadership Award to Marcos Castro Bojorquez Award. And the inaugural renamed award I'm going to present is to my dear sister, Bambi Salcedo. And Bambi doesn't need a whole lot of introduction. She is another person that reminds us that language matters, and if you know Bambi, you know that, she's unapologetically Latinx, a fierce leader in the community and the founder of Trans-Latina Coalitions. And she led her community, to do so much. And recently, because of their advocacy effort, California became the first state that actually passed the bill for a transgender wellness fund. And Bambi continued to make histories, and I think that she is really deserving to have this award. So congratulations, Bambi, and I will pass this to Bambi.
Thank you, Cecilia. Thank you so much. Primero que nada, quiero dar gracias a mi poder superior por darme la oportunidad de estar aquí con ustedes. Quiero honrar también la tierra en la cual estamos todas las personas, y también quiero dar gracias al comité planeador. I know that some of you were not able to understand what I just said, but I always acknowledge my creator, my higher power, for giving me the opportunity to breathe one more day. I'm also honoring your presence to all of you who are here. And I also want to honor the beautiful and amazing people who thought that I was worthy of getting this award and being recognized. Obviously, just having the honor to have my dear and beautiful sister and mentor and confidant and colleague and all of those things wrap around. My sister, Cecilia Chang, who has seen my growth and has supported my growth over time. So thank you. Thank you, Cecilia, for everything that you have contributed to fulfill my life. And also thank you to the beautiful and amazing people, who are here. The HIV and AIDS community, you're all of my people. This is where, I grew up. This is where I, come to be, and all of you have supported me in multiple ways, in different ways. And one way or another. So this recognition is particularly special to me. And even though we're not able to be in person as we used to before, this is nonetheless super special because I get to share this moment with all of you. And, that I get to just be recognized by my own people. It's certainly super special. So also, the fact that, Marco Castro Bojorquez, or that I'm getting an award on I guess, his name, it's kind of crazy because, some of you already know this, but Marco was also my dear friend, we're close. And even though, he's not here with us any longer physically, I know that his spirit still is here with us. And, I get to talk to him every once in a while, like we did before. And so, this is certainly extra special. This is sort of like a double whammy, if you will, right? Like just my getting this award from my HIV AIDS community, but also, having Marco's name attached to it. It's super special, and I'm so grateful. Thank you from the bottom of my heart to all of you for continuing to uplift me, continue to believe in me, continue to think that I'm worthy. Thank you.
Thank you, Bambi, and thank you for your leadership and for your remarks this afternoon. Our second award will be presented by Bob Cardell of the Positive Women's Network. Bob.
Thank you. Hello, everybody. I am honored beyond words to introduce Dr. Andy Spieldener as he accepts the Marco Castro Bojorquez Positive Leadership Award. Andy is a fierce advocate, accomplice, ally, scholar, co-conspirator, and friend. He has been a founding independent advocate with the U.S. People Living with HIV Caucus and has served throughout as a chair, as a co-chair, as a communications chair, sometimes all at the same time. I need to just sort of remember the first time that I actually saw Andy in a meeting because it speaks to why this award is so appropriate. We were at a federal meeting with partners and they were talking about programs that were going to impact the lives of people living with HIV. And we were all getting kind of frustrated. And Andy, true to form, let them finish and then said quite succinctly, well, we appreciate you inviting us. And here are the 4 reasons why that just isn't going to work. And that was our introduction to the brilliance, the brilliant mind that is Andy, as well as a little bit of the snark that makes Andy so powerful with his advocacy. Andy is a longtime community organizer. He is also a scholar and a professor and has connected these 2 worlds in ways that are so meaningful by writing scholarly articles that have included community members as co-authors, giving additional meaning to us being subject matter experts by having our names associated in these published journals. Most of all, what we honor today, though, is Andy's heart. Andy talks honestly about his sexuality and his drug use, demonstrating to others the power that comes from acknowledging and honoring our intersectionalities and the complexities of the lives of people living with HIV. Andy cares so deeply. He talks to people late into the night and has in times past held people when there's nothing else that he knows what to do. Andy is my ride or die advocacy partner. Andy is all of our ride or die advocacy partners. In conclusion, I want to congratulate Andy on this award and let you know that Marco and I and so many others are blessed to have you in our lives, and thank you for that. With that, I will introduce Andy Spieldener.
Thank you, Barb. I love you too. And thank you, HIV Caucus, AIDS United, and Treatment Access Expansion Project for holding this space where we celebrate leaders living with HIV. I'm honored to be able to share this with two folks that I've been blessed to call friends and family in my life, Bambi and Nana. I was lucky to work with Marco for years in the HIV Caucus. We didn't agree all the time, but we pushed each other and taught each other new ways of being in spaces together. Marco was a force. He made us examine our pain and love and struggle in our lives and in our movements. Marco envisioned a world beyond this one and always asked us why we were still acting and playing by the old rules, the ones that caused so much damage. We could be better. We can be better. My work with the HIV Caucus taught me that we can make each other better if we are open to it. I had to accept my position doesn't speak for everyone. I had to be open and decenter myself and our movement to learn to share power with other people living with HIV. In the HIV Caucus, we continue to demonstrate and learn new ways to share power while building community. In my position at Impact, a global gay health and rights organization, I bring these lessons with me as I continue to fight for our voice, people living with HIV, to be meaningfully included in the HIV response, even after 40 years. I applaud each of you for being part of the struggle, and I encourage us all to make some time to lift someone else up. Marco, I miss you. Thank you.
Thank you, Andy, and congratulations on your award. To present the third award, I'd like to introduce Benita Ray from the Positive Women's Network USA. Benita?
Hey, thank you, Ronald. So giving this award to Nana is really special because we get to remember Marco, who was pure magic, and we get to honor the people who do that same work in love, service to our community every day in the same spirit that Marco did, and that's Nana. I have the honor of serving with Nana daily as a partner in crime, co-conspirators. It's just been a true joy. Nana is fearless, she's bold, she's visionary, she's strategic, she's out-of-the-box thinker who's committed to PWN members and our movement. Nana makes space for others in ways that truly personify what leadership truly means. She's one of those unique individuals who's always ready for a fight. And I know y'all know this, I'm just saying it anyway. She'll throw down in a heartbeat. And then I've heard a few other folks who say she can party with the best of y'all and still show up the next morning for a presentation ready to go while others are moving, maybe just a little slower. Nana gives unselfishly every day. She's always uplifting others rather than herself. And trust me when I say people have no idea how much Nana does, and she would never tell you that. I'm telling you it. She spent at least a quarter of her life building PWN into the organization it is today. She embodies the true meaning of community leader, not because that's what she calls herself, it is what she does. She truly loves people and demonstrates every day the qualities of humility, love, and service. She sees beauties and gifts in everyone. And I can't even begin to talk about all her accomplishments, but just say PWN, which wouldn't be here without her. She's built the leadership of so many folks around the country, the world, right? She is co-leading groundbreaking work on the board for AIDS United, doing electoral campaigns right now, building power and advocacy at the ballot box. She was one of the chief architects behind Demanding Better and worked tirelessly with so many others to do this. Nana, has deep relationships with her family and her community and her friends. And I believe those relationships ground her to allow her to do the work she does. And I'm so grateful for her presence and all that she brings to this work. And it is really an honor to be able to honor her. On behalf of the thousands of PWN members and our staff, I'm so happy to give you this award as a token of our appreciation for your selfless love to us and the community. We see Marco in you every day and love you for what you do. You are one of the biggest cheerleaders for everyone else. It is time that we cheered you on and honored you. I know Marco would approve of this, and I am grateful and honored to introduce Nana Kana, who needs no introduction.
Wow. Thank you so much, Vanita. I'm kind of speechless. Thank you so much, Vanita. Thank you to the caucus. Thank you to AIDS United. Thank you to Treatment Access Expansion Project. Thank you also to our ASL and Spanish language interpreters for being here with us today to make sure this event is accessible. And congratulations to my fellow awardees, Bambi and Andy. This award means so much, and I'm truly humbled to receive this honor from so many leaders who I respect, admire, and look up to, Vanita being number one. And also to the US People Living with HIV Caucus, to the networks, to the PWN family, including our staff, our members, our board, our leaders, this community are collectively my friends, my mentors, and the people I turn to for support and guidance. You are my family. I am so grateful to be in this work with each of you. I know others have said today that people living with HIV have built such powerful community. Advocacy journeys can be difficult and at times lonely and even hostile, but it is in community that we hold each other up. And I am most humbled to receive this award in Marco's name. Marco Castro Bojorquez, presente. Marco taught me not just what it means to be an advocate, but also what it means to be a good human. Marco was always and forever guided by love, an unyielding love, a rigorous love, an uncompromising love, a love that never allowed him to accept injustice, oppression, or invisibility of communities that are not adequately represented or recognized. Marco was always the one to bring into the room anyone who is not there and to demand that we do better, to demand that they be included and represented next time. He demanded visibility. He called us into the most beautiful world we can possibly imagine. He demanded meaningful representation, justice, and equity for immigrants, for non-English speaking folks, for trans communities. He called us into safety and to honoring whole people, and he himself was wholly human and unapologetic about his own challenges and his calls for harm reduction approaches and for really honoring mental health as a part of our movement and mental wellness and spiritual wellness as a whole part of our movement. Marco called us to build altars that transcended this time and this moment, and that honored ancestors, and that brought us into the future. In Marco's name, I hope that we can all commit to do better. And let us be clear that while we are in a new administration, we are also in the fight of our lives and for the future of coming generations. We are in a moment where the fragility of our communities, our democracy, our safety, and even our planet have never been more clear, especially for Black people, people of color, and queer and trans communities, and for people living with HIV. It is because of this interconnectedness that the US People Living with HIV Caucus came together as networks of people living with HIV to create and publish the fiercely intersectional Demanding Better policy agenda, which centers human rights and dignity for our communities. And it is together that we are strong. So let us join hands and join forces as Marco would have wanted us to. Let us build circles of unyielding protection and safety for our most vulnerable, from our borders to our cities, and from Ukraine to Palestine. Let us always remember that our destinies and our struggles are interlinked, and that it is when we hold love at our center that we are strong. I thank you all so much for being part of what makes me strong. And Marco, presente.
Wow. Congratulations to Nana and Andy and Bambi. And thank you, Ronald, for leading us in that wonderful tribute to those three great leaders. You know, I'm Jesse Milan. I'm the president and CEO at AIDS United, and I've been around this epidemic since the beginning. And I know that we have had far too many funerals and memorials for people like Marco, and not nearly enough time celebrating our heroes who are living, our heroes and our sheroes. So I want to be among the first to both celebrate and congratulate the tremendous trailblazing advocates that we've recognized today with the first Marco Award. Nana, Andy, and Bambi, thank you for your incredible contributions to the HIV sector and to our movement for health equity and human rights. We are grateful for your incomparable leadership for people living with and vulnerable to HIV. And I hope you take this time to celebrate that we have recognized you. You deserve this and more. But there's one more advocate that we particularly need to celebrate and recognize today. One more person, someone who's been leading for our cause for nearly 3 decades, and he's now preparing for his retirement later this year. That's Robert Greenwald. Robert is the director of the Treatment Access Expansion Project. That is a longtime planning partner for AIDSWatch. And I'm so glad that we're taking just a few moments to honor Robert for his enduring and extraordinary contributions to our movement. From Robert leading the Center for Health Law and Policy Innovation at Harvard Law School, yes, he's a Harvard Law professor, to his serving as a member of the President's Advisory Council on HIV and AIDS, or PACHA, to his work as a consultant for HRSA and the Ryan White program, Robert has been a master policy and legal strategist for 30 years for HIV. And that includes serving as past chair of the Public Policy Council at AIDS Action, which is a predecessor to the AIDS United. I know Robert from his work for the CDC and HRSA Advisory Committee on HIV and AIDS, and I certainly know that we owe him a great deal of thanks for his past work on Ryan White reauthorization. Over the years, Robert's research and policy analysis and his personal advocacy have encompassed important legislative issues like criminalization, Medicaid expansion, the Affordable Care Act, as well as for the human rights and civil rights of all of us living with and vulnerable to HIV. All said, Robert has one of the biggest brains and biggest hearts for helping our people, and he's made one of the biggest contributions to improving the lives of millions. Robert, this may be your last AIDSWatch as a planning partner, but you will always be one of us. So as you retire to spend more time with your husband and your sons, please know, Robert, that you go with great gratitude and much love from all of us at AIDS United and from all of us who have attended AIDSWatch. And Robert, a word from Jesse: you don't ever have to wear a necktie again. Have a wonderful.
Wow. Thank you, Jesse. And Jesse knows I made a vow on my 50th birthday that I would never wear a tie again, no matter what. And I've stuck to that promise for the past 14 years. So, wow, I'm a little overwhelmed, but I just have to say it's really been an honor to be the longest serving member of the AIDSWatch Coordinating Committee. It's been almost 30 years. And certainly looking back through these years, we have accomplished so much, but we've also experienced really serious hardship. You know, I'm of the age now, I look back and I am clearly a survivor of this pandemic, but I can't ever forget how many of my dearest of friends are no longer with us. And it's certainly for them and for us that I have really dedicated my career to HIV law and policy. And I've been really committed to AIDSWatch. And AIDSWatch as an event has always given me hope, seeing hundreds of people living with HIV and affected by HIV coming together to educate our members of Congress and demand a response from them to our needs and concerns has always helped me to feel optimistic and hopeful and powerful. That there was a National Association of People with AIDS, and today that there's a People Living with HIV caucus has always meant a lot to me. People living with HIV must lead all aspects of our HIV advocacy efforts. And I've really been blessed to work and to play with so many members of the caucus who do incredible advocacy work, and to consider so many of you and to have so many of you as my dear friends. But really the same is true for me, for my admiration for AIDS United. Frankly, when NAPWA imploded, I was able to keep AIDSWatch safe and really turn to AIDS United for help. And they seamlessly said, let's do this. We didn't miss a beat. We didn't miss the next planning for the next AIDSWatch. And we really kept on going. And it's that kind of stepping up in leadership of AIDS United that I so much appreciate. I'm really thankful to be retiring now at a time when the coordinating committee for AIDSWatch between the treatment access expansion and the Center for Health Law and Policy Innovation and the caucus and AIDS United is really stronger than it's ever been. And AIDSWatch, Nana, and as everyone has been saying, it is as important, more important today than ever. I think there is so much on the line. We are living in such a scary time, and our advocacy is so important. But still, after 35 years, it's actually been 35 years that I've been, like when I first founded the first HIV law program here in Massachusetts, where I've lived and gone on to do the things that I've done. But it's time for me to retire. I know that, and I'm going to do that before the end of the year. My hope is to really, I've traveled so much, but I've not seen much because usually I just like pack my bag, go to a place, give a presentation, come home. And everyone's like, how was wherever I've been? And I really have no idea where I've been. So I have to say I have made a commitment to myself over the next couple of years. My husband's retired. My youngest is off to college. I'm going to see this country and I'm going to see this world. So I may not be at next year's AIDSWatch, depending on where I am in the world, and hopefully it'll be in person, not virtual. If it's virtual, I'll be there. But I certainly expect to be back as a participant, and just want to thank you all for, it's been such an honor. I have had such an incredible life and work life because it is so connected to my heart. And I feel blessed to have worked with all of you and to know you. So thank you.
Hola, me llamo Carbaloni Jr. y soy el vicepresidente y director de defensa de AIDS United. Bienvenido a AIDSWatch. Estamos muy contentos de que se haya unido a nosotros hoy. Hi, my name is Carbaloni Jr., and I'm the Vice President and Chief Advocacy Officer here at AIDS United. Welcome to AIDSWatch. We are so glad to have you join us today. Escuche atentamente a la información sobre los servicios de traducción. Seleccione su idioma usando el botón de interpretación en forma de globo terráqueo. Si usted está usando su computadora, el botón de interpretación se encuentra ubicado en la parte inferior derecha de su pantalla. Si usted no desea escuchar la narración en inglés de fondo una vez que haya seleccionado su idioma, vaya a la opción Menú y seleccione Silenciar audio original. Si usted está usando un dispositivo móvil, Android o Apple, haga clic en los tres puntos ubicados en los controles de la reunión y seleccione Interpretación del idioma, luego seleccione Español. Si usted no desea escuchar la narración en inglés de fondo, seleccione Silenciar el audio. Gracias. Comenzaremos la presentación en breve. Thank you. We will begin the presentation shortly.
Good afternoon, everyone. I want to first thank this year's Community Recognition Award presenters, Ronald, Cecilia, Barb, Vanita, and Jesse, and in particularly the awardees, Bambi, Andy, Nana, and Robert. Congratulations to you all. I think it goes without saying that without you, we may not have come this far. And so we thank you for all that you do. My name is Vanessa Johnson. My preferred pronouns are she, her, and hers. I am a 34-year-old long-term survivor of HIV. I'm also a founding member of the U.S. People Living with HIV Caucus. I am honored to be here this afternoon with this esteemed panel of policy advocates and activists, as well as some friends. Our panel on holistic and quality care panel is in alignment with the AIDSWatch 2022 policy brief, prioritizing that we ensure access to high quality comprehensive care. As stated in the policy brief, Congress must support the health of people living with or vulnerable to HIV with high quality comprehensive care, outlining care and treatment policy improvements, including insurance, Medicaid reforms, and increasing PrEP access, while also recognizing that barriers to comprehensive care, including intersecting oppressions, undermine the overall well-being of people living with HIV. Each panelist will have up to 7 minutes to discuss an aspect of holistic care, inclusive of prevention, that will help people living with HIV and other chronic health conditions access care that will help them maintain their health and quality of life. In other words, this panel discussion will encompass many themes and recommendations to ensure that when we are speaking of holistic care, that we mean care that goes beyond, but still supports viral suppression. I will now briefly introduce our panel in the order of their appearance. Preston will be talking about social determinants of health and the importance of holistic mental and physical care. JD will discuss policy in terms of living for folks living with chronic illnesses, particularly long COVID, and how that intersects with HIV. Raphael will talk about how we are responsive and meet the needs of folks who are drug users, and specifically the needs of folks who are living in Puerto Rico. Deidre will talk about expansion of access to care under Medicaid and other insurances. And finally, DeAndre will talk about reliable care and prevention, and specifically U equals U. So as they prepare to speak to our audience, I would like each of the panelists, before you go, to please state your name, your full name, preferred pronouns, your affiliation, and the policy issue that you will be addressing. So I'm going to call up Preston, and if you could do what I've asked all the panelists to do, that would be great. Thank you.
Thank you. I'm happy to. So again, thank you very much, Vanessa. We're certainly indebted to you for your brilliance and leadership. I'm Preston Mitchum. I use he, him pronouns, and I'm the Director of Advocacy and Government Affairs at the Trevor Project. I wanted to just start by saying thank you for the opportunity to speak about LGBTQ youth, affirming spaces, and mental health care and physical health care. This is just such a beautifully accessible event, and I'm honored to participate today. The Trevor Project is the world's largest suicide prevention and mental health organization for LGBTQ young people. We offer 24/7 crisis intervention and suicide prevention programs, which include Trevor Lifeline, Trevor Text, and Trevor Chat, as well as the world's largest safe space for social networking site for LGBTQ youth, Trevor Space. Trevor also operates education, research, and advocacy programs to help LGBTQ youth in crisis and to end suicide. As you may imagine, a lot of our work focuses on creating safe and supportive spaces for LGBTQ youth. And we know that the simple act of affirmation can quite literally save lives. Our research has found that having at least one accepting adult can reduce the risk of a suicide attempt among LGBTQ youth by 40%. So just one person can reduce the risk of a suicide attempt by 40% for LGBTQ youth. Further, a 2021 peer-reviewed study by the Trevor Project's researchers published in Transgender Health found that transgender and non-binary youth who reported gender identity acceptance from adults and peers has significantly lower odds of attempting suicide in just the past year. As we know, of course, school is an especially important environment where we need to ensure all young people feel safe and accepted. Our research in particular, and of course, connecting it with social determinants of health, shows that LGBTQ youth who reported having at least one LGBTQ affirming space had 35% reduced odds of reporting a suicide attempt in the past year. And that's the strongest association being with LGBTQ affirming schools. And so what does all that mean in the context of social determinants of health, of making sure that there are not these risk factors associated with who people are and really their care and concern as it connects to healthcare access? We know that LGBTQ youth are not prone to more suicide or related risk factors because of their identity, but because of how they're mistreated, stigmatized, and or criminalized by society and in these institutions. In much the same way, we recognize that barriers to comprehensive care include intersecting oppressions, which undermine the overall well-being of people living with HIV. People living with HIV face systemic barriers like racism and sexism and homophobia, transphobia, gaps in care due to lack of funding, among others. And much of that exacerbates harm already faced and that our studies show. In our work, we do a lot of teaching people how to support LGBTQ youth, but a lot of this work requires a process of unlearning. We have to work to allow people to unlearn shame, unlearn stigma, and unlearn misinformation. And this to the work that's needed to address HIV in a comprehensive, intersectional, nonlinear way. When it comes to HIV, we know that young people in the United States are especially impacted, and LGBTQ young people even more so. In 2019, young people ages 13 to 24 accounted for 21% of all new HIV diagnoses, and young gay and bisexual men accounted for 83% of all new HIV diagnoses in the people aged 13 to 24. We need to create an environment that fosters open and honest conversations about sexuality and health, and provide young people with accurate and inclusive sex education to combat the misinformation and stigma that fuels these disparities. Only then will we be able to tackle these social determinants of health and the disparate impact that economic and social conditions cause in many of our communities. At the end of the day, we need to work to ensure that all young people, no matter how they identify or their lived experience, are able to live happy, healthy, and authentic lives. This means also providing them support and affirmation, clean water, and safe schools. That also means ensuring housing needs are met. It also means providing investments in access to food and nutrition, as well as paying careful attention to ensuring that both mental and physical health needs are being met. Far too often, we forget the mental health care access for everyone, and especially young LGBTQ people who are at the intersection of multiple marginalized identities. And we can stop that today. Thank you very much for your time and attention.
Wow, Preston, I echo Nana when we say we thank you for your fierce leadership, advocacy, and vision. Thank you so much. I want to remind the audience that we will be taking questions and comments at the end of all the presentations. So please be mindful. If you're forgetful like me, write them down and then put them in the chat as AU is asking us to do. Thank you again, Preston. I am now going to turn this over to JD. JD, if you could do as Preston has done, your full name, preferred pronouns, affiliation, and what you will be talking about.
Hi, my name's JD Davids. I use he, him pronouns, and I'm with Strategies for High Impact. And we coordinate a new national group called the National Network for Long COVID Justice. And I'm really delighted to be here with you all today. I have some slides. Do they show now? Yes, thank you. I have many slides. I'm not going to go through them all, but you'll have them in the packet or for download afterwards. We've been working on a project called Resourcing the HIV Community to Face COVID and Long COVID in 2022. And we thank all of our HIV community partners who have worked on this, including our initiating sponsors, AIDS United, Broadway Cares, Positive Women's Network USA, and the US Caucus of People Living with HIV. So I want to share some of this with you here today. Next slide. So we know that really not since the emergence of the AIDS pandemic has there been such an imperative for large-scale change in healthcare, public health, and the unjust structures that bring inequitable risks of illness, suffering, and mortality. So I'm going to talk about long COVID, but it's just the most recent driver of a known phenomenon of post-viral illnesses that often clustered around a set of understudied complex chronic conditions, some of which I live with, and which many more people living with HIV now are experiencing in the form of long COVID. Next slide. So I'm going to start with the end because I'm not going to get to the end. The HIV community has been and is still being profoundly affected by COVID and long COVID, which is basically chronic COVID-19. People living with HIV might be at risk of more severe outcomes with COVID-19, more likely to have a lower antibody response to COVID-19 vaccines, and have higher rates of long COVID. In all of these areas, more research is needed, but we do have initial information for all of these problems that especially may impact those who have lower CD4 counts or comorbidities. The journey of living with HIV, especially for long-term survivors, brings risks of re-traumatization during the COVID-19 pandemic, as well as elevated risk of severe COVID and of long COVID. There's been a public health emergency in the country that has allowed for many things to happen and many things to not happen, such as people not being allowed to be kicked off Medicaid over the last couple of years. It's expected to end starting in September and through the end of the year. And that will threaten many supports, including telehealth coverage that has mitigated pandemic harms to people living with HIV. Next slide. So we are in our project, we have some initial findings that I wanted to share and can speak at more length when there's more time and be happy to talk with anyone about this. People living with HIV, many people and HIV organizations lack up-to-date and actionable information on guidelines and resources for COVID-19 testing, vaccination, treatment, and on long COVID. And that's not surprising. The information has been confusing and is changing often. The dual pandemics persist and feed on each other. So as you move forward in your work at AIDSWatch this year, Please know, as you probably do know, we need strong federal support for HIV programs, but we also need emulation. We need to sort of replicate what we've done in the federal and state roster of HIV programming for COVID and long COVID, and specifically adapt it for COVID and long COVID services for people living with and at risk of HIV. We need to address the risks of the end of the public health emergency, where people will be able to be kicked off of care they received during the pandemic, not HIV specific programs, but especially in states that hadn't done expansion of Medicaid. This may, risk more people who had gotten care during the pandemic to now lose it, including people who are doing HIV prevention through PrEP and family members, community members, and others. The ongoing COVID pandemic and onslaught of long COVID strains healthcare and support services that people living with HIV need, especially those who have comorbidities, frailty, or difficulty accessing services. Next slide. Our group Strategies for Impact, this is what we're here for. We're a comprehensive resource that's built by people living with HIV and people with other chronic conditions. And we provide strategic planning and partnerships, fund and resource development, technical assistance and capacity building, strategic planning. I've been very happy to work with many of the national networks of people living with HIV and expanding that work with our collaborators and staff this year. And we work on policy work, advocacy, mobilization, and rapid response. So feel free to reach out. Next slide. This is some of the stuff we're doing. I'm going to skip it. We're doing good things, and we'd love to have your participation. Next slide. So as we have a national network of for long COVID justice, and we had a recent webinar focusing on HIV and long COVID. And so that's where we had Dr. Michael Peluso from UCSF talking about those the likelihood of sort of more risk of harm in some people living with HIV, and also from patient leaders who are doing their own research and supporting policies of long COVID, who are living with long COVID, reminded us that that there's a strong evidence base that long COVID is affecting tens of millions of people in the United States, including people living with HIV who came to and spoke on our webinar. And one thing to remember and to advocate for is many people have had COVID. They may not even have known it, or they knew it, but they didn't get a test, or they weren't able to get a test, or when they got a test, it was a false negative. None of these things should be a barrier to COVID care or long COVID care. So if people are feeling sick in different or new ways over the course of the last 2 years, it may very well be long COVID. And while we need to learn much more about treatments and invest in research, there are things that may help. And there are things that could keep people at more risk of acute things like heart attacks or cognitive troubles. Next slide. So I'm going to skip this. Next slide. And just to end with, I'll just go through the first couple of slides here. We had an anonymous pilot survey in the HIV community about COVID and long COVID. Next slide. We had a sample where you'll see we had 68 people from 25 states, and then the people without HIV had much lower rates of obviously chronic conditions and disabilities. Next slide. But in our sample, which about 70% were people living with HIV, there was a large number of people who had tested positive for COVID-19 or had symptoms without a confirmed diagnosis or positive test result, and nearly 1/4 identified as living with long COVID, the long-term health effects of COVID-19. Next slide. It's estimated by the GAO that already 7.7 to 23 million people in the US already have developed in long COVID. And I'll be leaving this this session to go. There's going to be a major announcement from the health secretary at 3 o'clock about long COVID. So I encourage you to listen and support that if you have a moment, or look it up afterwards. Next slide. And so across our cohort, again, there was I'm sorry, I'm going to go to the next slide because there's so little time. And I'll wrap up to help Vanessa out. Again, one thing, if I can leave you with anything, besides the fact that COVID and long COVID are very important and have a lot of impacts on the HIV community, that also don't let lack of a positive COVID test stop you from pursuing care or resources, and to join alongside other people living with HIV and people living with long COVID who are working together now to make sure that all of our communities get what they need. So I think I'll leave it at that because I know we have many other great speakers today, but as you'll see, this is the first of several sections of this data that also includes quotes about some themes that arose, which included the need for telehealth services have been very helpful to people. People are experiencing a lot of stress and mental health challenges, particularly if you're living with HIV during the COVID pandemic, and so we need to have comprehensive services in HIV that specifically address COVID and long COVID in the lives of people living with HIV and people in their communities. So I'll leave it at that, but look forward to continuing to work in partnership alongside my loved ones and comrades living with HIV, as I've been privileged to do for the last 30 years. Thank you.
Thank you, JD. As many of individuals chatting are stating that this is very vital information that you're providing. And could you just state one more time? There was one particular question, and just briefly, because then we'll go to the next speaker. The update is today. That's what folks are asking.
Yes, I can tell you now because the embargo lifted at 2:30, which is now, which is that Secretary Becerra is making a major announcement at 3 p.m. that the president is asking Assistant Secretary Levine to lead an interagency task force that will report in 120 days with 2 reports. One which will be about the federal role addressing the long-term impacts of the COVID pandemic, including long COVID, people who have lost loved ones who are bereaved by COVID, and people who are experiencing mental health and substance use challenges. So that's the first report. And the second report is going to be about a national research action plan on long COVID, which is desperately needed. And there's already a big research study that has a lot of challenges where we appreciate support on trying to get patient leadership involved, like we did in HIV, to change what needs to change in that. So it's a big announcement, and it's something that's going to need a lot of resources. And we have to make sure that those from the most affected communities, including Black, Brown, and Indigenous communities, and people who are disabled and chronically ill, are at the table, just like we do in HIV for everything that happens in long COVID. And you guys are going to send, AIDSWatch is going to send out copies of the slide. If you need them ASAP, you can contact me. I'm going to put in the chat.
Thank you, JD. Appreciate you. We're now going to go to Raphael, who's going to speak about drug user health and needs that are specific to Puerto Rico. Raphael?
Saludos y bienvenido y bienvenida a todos. So first, thank you for being here. My name is Rafi Torreya, he, him, and I'm Executive Director of Intercambios Puerto Rico, a harm reduction organization down here in Puerto Rico. So today, my objective when I got tagged to be part of this amazing panel, thank you again for asking me to be here, I then decided, like, what can I provide you with, or how can I give you an idea of how we provide comprehensive care, or try to get close to comprehensive health care for people who use drugs here in the eastern side of Puerto Rico and for homeless individuals. So I decided to show you our team. Next slide, please. Basically, this is part of our team. How do we do it? We're a harm reduction organization. So we do it from the street. We go literally to where people are at. When harm reduction says be where people are at, it means physically, it means emotionally, it means psychologically, it means getting into their context, not just doing mobile outreach, but we obviously do that. We are a non-governmental organization founded in 2009 in Fajardo, and this is part of our team. Medical mobile unit on the left, and syringe exchange program mobile unit to the right. Next slide, please. This is our mission and our vision. I won't spend too much time here, but just want to say we're a harm reduction organization in a time where now harm reduction is becoming a thing. We've been doing harm reduction here in Puerto Rico since 2009. And I personally have been doing harm reduction for about 20 years now, which sounds odd when I say it, but it's all from a social injustice point of view and approach. Next slide, please. So basically, let me give you a little breakdown on the participant profile. We provide services on the eastern side of the island, and 90% of our participants receive services are men between the ages of 24 and 45, and 100% of them consider themselves Latino or Hispanic. Sometimes that drops to 99% because there's also people that stay over on the island and also become our participants. Approximately 50% of participants are homeless, and it depends on the definition, of course, and 100% live in extreme poverty. Next slide, please. These are the areas that we provide services to in the island. We're in the northeastern side. Our offices are in Fardo, in the corner. And we provide different services in different areas, but our main service, next slide, please, is a syringe exchange program, but we try to be more comprehensive. We started a syringe exchange program and quickly we understand that our population had very specific and needs that were not met. So we try to address these barriers. We try to come closer to these needs slowly but surely and start providing comprehensive as much as we can services. Basically start approaching the social determinants of health that our participants are already letting us know that are very much there. So here in Puerto Rico, we, as in many other places, are dealing with 1, transportation, 2, the lack of advocacy or accompaniment, like participants do not get accompanied to basic healthcare services or behavioral health services, therefore they don't get services. Just access in and of itself, it's difficult. Number 3, we try to incorporate as much as possible mental and behavioral health services. Then we took another step and started doing access to housing. Then recently physical health, and finally access to job training. Next slide, please. So to give you a basic, how do we started responding? As I mentioned before, we started with a syringe services program that we do in about 21 communities around the eastern side of the island, as I mentioned, and we were around 360,000 syringes, so it's a moderate-sized SSP, not huge, but there's a certainly amount of people that are being provided with syringes, and we don't even come close to the need. This is as much as we can push. So we provide syringe exchange through peer workers. We understand the peer model, peers not being a position, but peers being a gaze, a way upon which you understand people who use drugs. We do overdose prevention, which is becoming a big thing, not as much as the particularities here in Puerto Rico, and obviously safe sex kits. Sorry, it says safe sex there. We certainly want to safe sex, but what we're doing is safe sex or safer sex. The policy recommendation here that we're really trying to push both locally and federally is that we want adequate funding for SSPs. We've been doing this fight for many, many years. I've been around SSPs for about 20 years of my life, and we only now are we beginning to talk about harm reduction in a way that starts to make sense, in a way that the federal government is starting to listening and perhaps understanding more deeply what is meant by harm reduction from the communities. Next slide, please. We then, after the SSPs, we started scaling up services with what we started calling red de acceso. Basically is access network. Through those services, we started providing case management, HIV testing, certain nursing services or nurse services, prevention navigation, and services specifically to immigrants, to the LGBTQ community, and to youth. And the recommendation there, the policy that we're trying to push at the same time, is fair access to HIV treatment. Puerto Rico has HIV treatment, but we're still very much not at the level at which we should be in some basic things like PrEP. PrEP levels are really low here in Puerto Rico, and still prevention services in Puerto Rico are far and few between, and we need to uptake that quite a bit. Next slide, please. Once we started growing a little bit more, then we started providing access to housing services for some of our folks through the Sin Techo or Without a Roof program. Here, we continue emphasizing peer specialists, case management, mental health counseling. This is a part of behavioral health became more of a issue or more of a service that we provided here in Intercambios, and substance use disorder counseling to start focusing more deeply, not just on prevention services, but on treatment in and of itself. And the recommendation that we started doing here very hard and very pointedly was housing first. Housing first here in Puerto Rico, like in many other places in the United States, is many times said from the mouth out, but not really providing housing first and being able to provide that services, housing services to people who actively use drugs. Many times services are provided, but then to people who use drugs, but then they're required from day one to cease their use in abstinence. And we know that doesn't work. That is not harm reduction. Housing first needs to be a harm reduction approach. Next slide, please. And now, more recently, we started our clinical services through La Mobile. That mobile unit that you saw at the beginning, this is where now we provide basically health services through our nurse and an MD. We bumped up our psychological or behavioral mental health services through 2 psychologists, then clinical case management, and of course, peer worker support. We also, I must say that we are still in the grieving process. One of our peers just passed away from overdose. So overdose, none of us are exempt from having close to us overdoses in this field. So we're feeling it pretty close recently here in Puerto Rico. And of course, what I would say is the access to integrated services from a harm reduction perspective is still very hard to come by. Low threshold services, low threshold harm reduction services for people who use drugs and homeless individuals needs to be pushed both locally and at the federal level. Medicaid parity for Puerto Rico is not accessible right now. Puerto Rico takes a heavy burden on keeping Medicaid, and right now there's fiscal cliffs for Medicaid in Puerto Rico. And obviously another piece that I must bring is addressing the colonial status between Puerto Rico and the United States. So we have a more just relationship with the United States. Next slide, please.
Dr. Raphael, I don't mean to interrupt you. Could you start wrapping it up though?
Yep, this is the last slide. Our drug policy advocacy program is what brings everything together. Políticas de Drogas Conciencia, this is our policy side of the organization that takes those policy recommendations from our different programs that provide services, and then we go and do the work both locally and at the federal level. Next slide. And that is our information. Thank you very much for your attention.
Thank you. And thank you for all the work that you're doing to address the needs of the drug using population, as well as the specific needs of folks who are living in Puerto Rico. You had a couple of questions in the chat, and if we have time, we'll get to those questions at the end of the presentations. We're now going to move on to Deidre, who's going to talk about access to care for people living with HIV through the use of insurance, in particular Medicaid. Deidre? Hi.
Hello, everyone. Thank you, Vanessa, the icon, Vanessa, for that introduction. My name is Deidre Johnson. I almost said it, y'all almost said it, with Deidre Johnson, but a lot of you all know me as Deidre Speaks. My pronouns are she, her, and if you want to, BBQ, barbecue, a beautiful Black queen. Please feel free to even call me that, or just Deidre Speaks. Or red glasses, as many of you have said. So I'm going to keep this like my family would say, like a bit similar to a mini skirt, long enough, or short shorts, long enough to be interesting and short enough to cover the important parts. I am affiliated with so many organizations, including Positive Women's Network USA as a state lead for Virginia. I am also a member of the Zero Project Justice Institute and just recently graduated. And I'm also the Zero Project Micro Grant Program Manager. And then lastly, but not least, there are 2 other places, and that's with ECHO VA, ECHO VA. and that is Ending Criminalization of HIV and Over-Incarceration in Virginia Coalition. And we have been responsible. We just celebrated our 2nd anniversary of the passing and reform of our infectious sexual battery law in Virginia. And ECHO VA Coalition, along with Equality Virginia, Zero Project, and the Positive Women's Network, were able to make that happen. And lastly, I'm actually coming from the perspective of Deidre Speaks and Deidre Johnson. This is going to be a personal story, but I hope that you hear in everyone else, in my story, everyone else. So I've been a person living with HIV for 22 years. I found out my HIV status when I was pregnant with my youngest. Many of you know Zion. And I'm grateful for being pregnant at that moment and finding out my status. One of the pieces that has been very instrumental in my life has been working very diligently and very hard at making sure to sustain a life for both of my kids. I not just recently, but at the age of 35, I ended up having to go on Social Security. Being on Social Security over the last few years has created a bunch of problems, as you would think it would be helpful. But unfortunately, because of the amount of Social Security that I get, then it makes me ineligible for many programs. So I'm torn between my primary income and assisting and doing my advocacy. This has recently showed up in a space where, because of different Medicaid responsibilities, sometimes I don't even qualify for HOPWA, other programs in the space because of the amount of Social Security that I get. As we all know, and thanks to our esteemed panelists that have come before me, we have talked about housing, we've talked about access to care, we have talked about everything that has been detrimental to quality of life. In November of 2021, I lost my housing and have been living in a hotel for the past months, excuse me. And I have reached out to many organizations. Like several of you and many of my advocate partners in change have experienced this very same and similar issue. Because of that, we have ran into where funding is not available or they would like to put us in spaces and places that are not safe, that are not healthy, and not productive to our quality of life. So one of the things that I actually implore you, and that was a reason why I did not do slides, is I really implore you when you go to speak to all of your representatives to ask them for more funding for Medicaid expansion, ask for more funding for programs that will assist individuals that are in need of housing, that are in need of access to care, especially in rural areas, as well as in need of access to PrEP and PEP. We all know U equals U, who my esteemed panelists after me will discuss. And I really honestly thank each and every one of you who have paved the path for us to be able to be advocates, to speak up and to speak out. We all know Adidja Speaks, not just this one, but someone else in our lives that are dealing with access to care through Medicaid or Medicare. And we know that if we are compensated for some of the work that we do in this world, that it will also impact our benefits with Medicaid and other things. So I suggest to us all that we ask for unrestricted funds, the availability to be able to have access to affordable health and safe healthcare, as well as access to care, as well as access to housing, and as well as safe food and affordable food and access to great food for us all. I thank you from the bottom of my heart. I thank all of you for the amazing work that you do. And thank you, AIDS United, for having me today. Thank you.
Thank you, Deidre. There's nothing like a lived experience story that can illuminate the importance of addressing the social determinants of health that keep us healthy and give us the quality of life that we deserve. So thank you so much. Our last and final speaker will be DeAndre, who's going to talk about reliable care and prevention. So I'm going to let you do your thing and close us out.
Thank you, Ms. Vanessa. I appreciate you. And thank you to all the other panelists who have spoken so well and did such a great job. Deidre, that personal story I think speaks to what I hope everyone can model after whenever you have these visits with your congressional members, is tell those personal stories, hit them in their hearts, make sure they feel you, make sure that they understand you, and make sure that your story connects with those representatives. That's one of the best things that you probably will be able to take away from our talks today. So again, my name is DeAndre Moore. I am the Director of U.S. Partnerships and Community Engagement with the Prevention Access Campaign, which is the founding organization of U equals U, or as you all know, undetectable equals untransmittable. When thinking about reliable care and prevention, there are a few things that I think that we had to highlight. One of those things being prioritizing people living with HIV, whether it's from the prevention side or the care side. And what that looks like specifically is using the model that we use when we talk about U equals U, or how to convey U equals U to members of Congress or those in power and stakeholders across our country, is the public health strategy or the public health argument of U equals U. It's a cycle that we use to end the HIV epidemic, which starts off with removing barriers to care and creating easier access to treatment. And then ultimately, then improving, which will improve the well-being of people living with HIV, ultimately getting them to reach undetectable viral loads, which, as you all know, prevents transmission to their sexual partner or partners, ultimately ending the HIV epidemic. Now, when you think about prevention, think about all the prevention mechanisms out there, or prevention options that we all have, from PrEP to condoms and so forth, and also U equals U. Only one of these, and this is not to put any of them down, but one of these is actually the only one that's proven to be 100% effective, and that's U equals U. That's having an undetectable viral load. And that's why it's even more important that we continue to prioritize those living with HIV, because it provides a strong rationale and a strong argument that when we prioritize people living with HIV, that's how we truly see an end to the HIV epidemic. The CDC has put out data supporting this claim, citing that if we get at least 94% of people to reach undetectable viral loads, then we can actually see a huge decline in new HIV diagnosis by the year 2030. Now, there are certain ways that you have to communicate U equals U with your stakeholders or with your congressional representatives and senates and so forth. You want to make sure that you kind of lead with the messaging around U equals U and what that means for people living with HIV, as well as why it's so important. You don't want to say things like negligible or extremely unlikely, or that the effects of U equals U is virtually impossible or close to zero, or that it helps prevent. You want to say things like, you actually can't pass it on, you can't transmit it, it's impossible, there's no risk or zero risk, and it does prevent HIV. When we're thinking about prevention also, we also think about testing. One of the peer-delivered studies that we've seen is that U equals U is aligned with HIV testing goals. We saw that adult men in a high HIV prevalence in South Africa setting almost doubled the portion of those who were willing to get tested once they learned more about U equals U. So education matters. And this also falls under the realm of reliable care. It's an impact. We've learned from the positive perspective wave too that U equals U education leads to positive health outcomes. Optimal overall health showed us that, well, from the study showed that optimal overall health increased to 61% as opposed to 45% when folks were informed about U equals U. We also saw an increase in mental health for persons living with HIV when they knew more about U equals U from their healthcare providers. It increased from 63% to 63% as opposed to the 38%. And the viral suppression rates that were reported also increased when folks were informed by their healthcare professionals about U equals U to 77% as opposed to 56%. And here's why that's all important. We have an opportunity here when you meet with your members of Congress to ensure that this information and the education around U equals U is not only implemented, but that it's required by state and local health jurisdictions. I'm asking you all to encourage your respective representatives to ensure that these institutions or organizations and health jurisdictions that receive federal funding make it a requirement and a priority for those who do serve people living with HIV to implement U equals U education. At this point, there's no reason why it's not being taught all over this country, let alone all over this world. And so we have a duty and the opportunity here to continue sharing that messaging and so forth. As I've also said, we also want to make sure that this is introduced in the forefront. You don't want to wait till the last minute to talk about you equals you. This shows us how much people living with HIV mean to us. This education and this language is needed. And this is, again, is the opportunity that we continue to share that with folks. I am not going to hold you guys as we're running out of time. Again, my name is DeAndre Moore. I will put my information into the chat. And if anyone has any questions, comments, or concerns, or wants to continue this information with myself, please feel free to reach out to me at any time. And thank you so much to AIDS United for the opportunity. And I'm turning it back over to you, Ms. Vanessa.
Hey, thank you. And thank you. Thank you. Appreciate your presentation, DeAndre. It's important. I want to thank the panelists and thank all of you in the audience for your participation. We also want to acknowledge the loss of people that were mentioned before this panel and during this panel. We know that that leaves an empty hole in many of us who may have known that person, because it's just a reflection of the fact that we lose far too many people too soon. So with that said, with the few minutes that are remaining, we're going to respond to a few questions. I'm going to circle back to the first panelist and start with a question to Preston, because I feel like it's an umbrella question, because what we're talking about is how do we bring everyone into one accord so that folks can live the lives that they envision for themselves. So Preston, how can we help people unlearn harmful thoughts, attitudes, and actions? Because I know that's one of the things that you talked about earlier.
Yeah, I appreciate this question and thank you for asking it. One of the things that's most important to not only myself, but the work of the Trevor Project is by realizing that when we approach all of these issues, it is because we're doing such in an intersectional, comprehensive way. And so one of my favorite quotes by Audre Lorde is, none of us have single issue struggles because we don't live single issue lives. And so when we're thinking about the ways to actually connect people to care, to connect them to resources, right? We're realizing that we're actually doing it on multiple fronts. All of us actually still need access to healthcare. All of us need access to clean water, to food and other nutritional assistance. And I think once we recognize that we're actually all collectively better together, it's a little bit easier to get to the unlearning aspects of all of this. All of us are learning every single day. Myself, I'm still unlearning the things that were taught to me in such toxic and harmful ways throughout my entire life. And the more we start to learn a bit over time, right, we all collectively understand that we're just a little bit better together because of that. And so that fundamentally for me is how we actually start, just by those connective pieces over time. And I don't pretend it's easy. It never is. And we'll still be better when we walk this line or when we actually move forward together.
Thank you. And we have one more time for one of the panelists to respond, if you would like to respond to that question as well. Or if there's a, go ahead.
Lisa, I would just definitely like to say that, especially amongst advocates, we have to learn that because of we're not single issue people, that we have to advocate for and with each other, period, point blank. And we have to do that because we all are experiencing something from the COVID, from the homelessness, to not having access to PrEP and clean water, to all food, all of this. We all are experiencing it. And if we stay siloed in these spaces, we cannot move to a space where we are open for everyone and anyone and their issues and how they show up authentically and for real. And so until we can start to break down those walls, those barriers, those roadblocks, and work together, we will never be able to get to a space where we have united front in this work.
Thank you so much. And that is a great way to end this panel. We now understand more than ever why there is a Deidre Speaks. So thank you for that. I want to thank all the panelists. All of you were fabulous. And you've already stated for folks who want their slides that those slides will be available. So we are going to give back 2 minutes to AIDS United so they can prepare for the next panel or the break. And want to thank you all for participating. Thank you so much.
Hi, all. Thanks so much. Thank you to our incredible panelists. Wow, what a powerful panel. We're going to be back together at 4 p.m. Eastern Time for our next session on civil rights. Thank you all so much. See you soon.